All right, it looks like the waiting room has slowed down just a bit, so we'll go ahead and get started. Good afternoon and welcome. Thanks for joining our webinar today, which is entitled An Introduction to Maine's Community Health Center Network. The purpose of this webinar is to provide a high-level overview of the community health center model, provide information on Maine's community health centers, and also an overview of who the Maine Primary Care Association is. So we're hoping that whether you're a new health center employee, a job seeker, or community partner, that you walk away with a bit of new information. Please feel free to put your name and organization in the chat. And if anyone, I can't see the waiting room or the participant list, but if anyone is joining from a cell phone, if you could identify yourself in the chat, your name and your organization for attendance, that would be really great. All right, so as we move forward, we quickly just want to take a moment to acknowledge that the Health Resources and Services Administration, also known as HRSA, provided the means to host this webinar, and the contents are those of MPCA and may not reflect the policies of HRSA, HHS, or the U.S. government. And before we get started, just want to quickly introduce ourselves. My name is Emily Ferry. I'm the Director of Training and Technical Assistance for the Maine Primary Care Association. I've been with the organization for a little over 4.5 years now, and I'll turn it over to my colleague Hannah just to quickly introduce herself.
Hi, everyone. Great to see you all today and great to see so many familiar faces on the call. My name is Hannah. I'm the Director of Policy at the PCA and have been here about 4 years.
Great. Thanks, Hannah. All right, on to the agenda. So here is an overview of where we're headed. We're going to spend some time defining what makes a community health center a health center. We'll give an overview of Maine's health centers, share some information on what MPCA offers, and then provide a brief intro into MPCA's CHC Ambassador Program, and also a brief overview of some of the resources MPCA offers to its members. We encourage you to put any questions into the chat, and we'll plan to address them at the end. I know folks are on mute, so when we get to the end, if you do have a question you want to say out loud, we will certainly unmute you. And just for a bit of housekeeping, we will share the recording after this session. And finally, when you log out of this webinar, you're going to be asked 2 survey questions about the session. Please take a moment to complete that. It's really helpful to incorporate any feedback as we plan more sessions like this. All right, we're going to go ahead and get started. All right, so community health centers, also known as federally qualified health centers, you might hear us interchange FQHC or CHC acronyms interchangeably. CHCs provide high-quality primary and preventative medical, behavioral, and dental services to patients and communities. CHCs are providers, employers, and partners of choice across the country. Nationally, there are over 14,000 community health centers that deliver care at about 14,500 sites, and they serve about 32.5 million people each year. And besides better patient outcomes, the health center model of care decreases the use of costly care choices, such as visits to emergency departments and hospitals. And CHCs are really pivotal to communities they serve by improving health outcomes, lowering overall healthcare costs, and generating economic opportunity by providing jobs and training to people from the community. Sometimes when we're talking with folks, people will ask, well, what makes a community health center different than other healthcare facilities? CHCs have 4 unique characteristics. First, they offer comprehensive services based on community need, including medical, dental, vision, behavioral health, and other support services, which we'll talk about in just a moment. They are open to all people, regardless of insurance status or ability to pay. And they also offer sliding fee scale options for people. They must be located in areas that are designated as medically underserved by the federal government. And then very lastly, 51% of their board must be made up of their patients. So this really ensures community voice in the services and programs that health centers offer. All right, so getting a little bit closer to home here in Maine, we have 20 community health center organizations with over 100 service locations across the state. Health centers in Maine serve over 200,000 people. We also say 1 in 6 Mainers. And those pictures below, you'll see to the left, those are logos of MPCA's member community health center organizations. And then to the right, you'll see a map of the different member health center sites across the state. And I just want to mention that this map is also located on our website as well as those logos, in case you'd like to take a closer look, or even click on one of those site locations and be directed to a health center site. All right. As noted before, Maine's health centers provide affordable primary and preventative care, but they also integrate additional services such as substance use disorder treatment, dental care, and pharmacy. Maine's health centers make up the largest independent primary care network in the state. It's really important to mention they improve access to essential healthcare in communities with provider shortages in both rural areas of Maine and some of our most densely populated areas, which you saw on that map on the previous slide. All right, this is our overwhelming slide. Health centers provide comprehensive care under one roof and promote whole person care and well-being by addressing both physical and mental health needs. This slide is overwhelming, but purposefully so. We wanted to demonstrate the vast number of services provided at Maine's health centers. And I'm just going to pause for a moment so you can really take this slide in and see all the different services that are offered within Maine FQHCs. As I mentioned, health centers provide whole person care, meaning they work very hard to meet patients' needs even outside of the exam room. They are leaders in innovation in taking care of the people that they serve. While programs may vary at each health center, some health centers might provide health education, nutrition assistance, outreach and enrollment, food access, housing, and more. Just really pointing here to the critical part health centers play in healthcare infrastructure across our state. Some of Maine's health centers offer primary behavioral health or dental care within a school setting, also known as school-based health centers. SBHCs are a vital resource in promoting both physical and mental health for students, contributing to healthier, more engaged, and academically successful individuals. Examples of care provided at schools might be annual well child visits, sports physicals, counseling, immunizations, or dental exams. And then to get into some granular data here, this slide reflects data on the number of patients and services accessed. As you can see, Maine's health centers provide vital care and support their communities. I also want to flag that almost 12,000 enabling services were provided. That means a service such as transportation, health education, interpretation, or case management was provided to increase access to care. And below, you'll see demographic information on groups of people that health centers serve. Also, just really quickly want to highlight the small photo in the bottom right-hand corner. Some health centers have mobile units to be able to provide care in the community and meet people where they are. So you can see, I know it's a little bit small, but that is, I believe that's Fish River Rural Health's mobile unit. And at this point, I'm going to turn it over to my colleague, Hannah.
Thanks, Emily. All right, so we wanted to highlight Medicaid as well, just given that it's such an important topic at both the state and federal level right now. And Medicaid, also known as MaineCare, is the foundation of Maine's healthcare safety net. It ensures access to essential services that Emily just discussed, and these services are for everyone in our community, but particularly low-income families, older adults, people with disabilities, those living in rural communities. It's a vital program serving hundreds of thousands of folks across the state, and Medicaid funding directly supports community health centers and other provider types as they keep care accessible and affordable to those who need it most. For each health center, each individual health center is their own organization. They may have a different payer mix, whether it's Medicaid, Medicare, private insurance, uninsured individuals. But across the network, Maine's CHCs are providing care to 1 in 6 of Maine's total MaineCare population. And once again, highlighting kind of the excellent return on investment that comes from a strong CHC. Maine CHCs only account for about 2% of the MaineCare spend in our state. So preserving MaineCare means protecting Maine's most vulnerable populations, ensuring access to quality, affordable care, and a strong Medicaid program reduces the overall healthcare costs and safeguards the health of our state. And CHCs have an important role to play in this. Next slide. So we will now turn to the Maine Primary Care Association, the group that Emily and I both work with, and explain our role in supporting Maine CHC network. For members of the CHC workforce that are on this call, we hope that if you're not already engaging with our team, this will highlight some of the resources we have available to you. For those outside of our network, if you see a place for potential partnership or collaboration, please reach out. We are always interested in engaging with stakeholders across our state on a number of different topics. Next slide. So MPCA is a membership organization for Maine's Community Health Center Network. And we are also a training and technical assistance provider for all CHCs in the state. We also serve as a major hub for programs and services that support this network. And this includes a couple to highlight here. The Health Center Controlled Network, which helps participating health centers leverage health information technology, so HIT, to improve health outcomes, prepare for value-based care models, and share resources on the various electronic health record systems that are used by health centers across the network. We are also home to the MPCA Patient Safety Organization, the first PCA-led FQHC-focused PSO in the country. So we're very proud of that. But PSOs conduct activities to improve the safety and quality of patient care by working with clinicians and healthcare leaders to reduce risks and hazards. So in addition to big programs like that, we also host a number of interest groups. You can see here on the slide, our last total for last year was 38. And these are spaces for the health center workforce to connect with colleagues in similar roles across the network and collaborate, share best practices, receive trainings, and more. And another element of work at the PCA, which I am very fond of, is our advocacy and public policy work. So we are the voice for the network priorities in Augusta and in DC, and also spend a lot of time working in partnership with folks in state administrative offices to provide the CHC perspective on programs and policies that impact our network members. Next slide. So a little bit more on our training and technical assistance offerings, which cover a wide range of topics, and a snapshot is included here. We are responsive to CHC needs and also manage a number of state and federal grant programs. And through this work, we're providing webinars, conferences throughout the year that bring in CHC team members together and also partners throughout the state. This includes our annual conference in the fall, which many folks on this call have been part of, and our patient safety conference that happens in the spring. Within this work, we are aiming to strengthen Maine's health centers with programs, services that are really covering a number of topics that are of interest to our members. This includes clinical quality improvement initiatives, workforce development, a huge focus right now on recruitment and retention, and that is an issue across the healthcare sector and is no different for Maine CHCs. We're working on community outreach, health information technologies, risk management planning, strategic planning, and more. And we also work to amplify messages shared among member health centers, bridge medical practices in the public health sector, and provide linkages to community, state, and federal partners including public health and allied agencies. So a lot of work happening in a lot of different areas, but we're very proud to be able to support our CHCs with this work. Next slide. So turning to our CHC Ambassador Program, this is a program that is open to all health center staff, board members, patients, community partners, really anyone who is committed to ensuring accessible care for all Maine people, or just anyone who wants to stay up to date on what's happening in the world of CHCs across the state. The program is designed to bring together volunteers who care deeply about our network and the health centers that are in it. And ambassadors work with their local health center, MPCA, to advocate for health centers and advance our policy priorities within the state of Maine and nationally. Signing up for the program doesn't come with any required actions or costs, but you do get access to us, really. You can receive trainings, have access to resources, and if you'd like to become more engaged, we've got a team ready to support. Next slide. So in addition to the newsletter and the resources, we also host a few different events for our health center supporters and advocates. In January, we host a breakfast with members of the legislature and spend time in Augusta and at the State House, advocating and connecting with members, doing some informational sessions, tabling all the usual Augusta-related activities, but a great chance for a lot of our health centers to come together and be represented and share what's kind of unique to their communities that they're serving. In February is usually the month this happens. Members of the PCA team and CHC representatives from across the state travel down to Washington to meet with our federal delegation. We celebrate the strength of this network across the country. There are health centers in every state. There are PCAs in every state. It's a really amazing network to see in person when they're all together in DC for Advocacy Day. And that photo in the middle line with kind of the black modern art behind it, that is a photo of kind of one group of us starting our day in the Senate office buildings down in DC. And then the photo beside that is of our CHC crew that this past year in one of our senators' offices. We also have in August National Health Center Week. So this is really a great place to start to get to know your local health center. Every August, there is a week dedicated to celebrating this community across the country. In addition to open houses, community days, staff appreciation events, CHCs also are doing a number of activities to continue further giving back to their communities. They've held diaper drives, collected back to school supplies, distributed fresh vegetables, organized blood drives, and a lot more, just demonstrating that continued commitment to their mission of supporting their communities that they're serving. So really encourage folks to check out August excitement throughout the state. Next slide. So the signature resource for our ambassadors is this monthly newsletter that we've mentioned. And the primary goal here is just to spread the word about the great things that are happening throughout the state. We can be sometimes considered the best kept secret in healthcare, and we're really working to make sure folks are aware of what's happening within the health center network and probably within your own community. These are just a few of the stories we've recently highlighted in our newsletter. There is definitely an increased need for healthcare services throughout Maine, and health centers are often on the front lines of responding to that. They're right in the communities that they're serving, and they're expanding. So here we're just kind of, the theme here is look who's building. We've got Hometown Health Center in Palmyra starting a new wellness center. Fish River is expanding their facility in Madawaska. Eastport has opened a new place in Machias and is working on updating their health center in Eastport. So there's just a lot of activity and a lot of good stories to share throughout our health center network. And so this newsletter is really our way to do that and to make sure that everyone gets to hear what good things are happening. Next slide. So what does a CHC ambassador do? So as I said, no requirements for ambassadors. And really, if you just read the newsletter, you're doing amazing work. We want folks to really learn and understand what health centers are up to, and that's kind of the core part of it. But if you do want to get more involved, if you feel committed to the CHC that you're part of or that you know in your local town, we have a number of opportunities for folks to do that, and staff at the PCA that are very much willing to help you and support that work. Whether it's writing an op-ed, hosting an event to feature a CHC, engaging with us on social media and sharing information about your local CHC or what the PCA is up to. We do a lot of work to help folks stay connected with their elected officials. As part of the program, you'll receive action alerts when there's a major topic happening at both the state and federal level, whether that's a bill that we're focused on, that's continued funding for health centers down in DC. Those are things that we share with folks, and we share talking points, examples of how to reach out to somebody, provide kind of all that support so you understand what to do and are able to advocate to the best of your ability. We also encourage folks to really just promote CHCs whenever you can, invite them into group events or community meetings and things like that, or search them out and say hello. They're really a core part of communities, and because each health center has a different name, you might not even realize that it's part of the CHC network. But we're really hoping to help folks understand that this network is a strong example of kind of the power of a healthcare network in our state. And I'll put the link in the chat for folks to be able to sign up for the ambassador program if you're interested. And next slide. And so here we've connected a number of resources that have been referenced today by Emily and I. Of note, I'd like to highlight our job board, and Emily could probably speak more to it as well, but it's really a great spot to start if you are a job seeker, to look at openings across the state for CHCs. The events calendar holds a number of our training and TA options for health center staff members who are interested. And then, of course, more of the ambassador program, education and advocacy resources, and our staff contact information. So I'll invite Emily back in, but also we're going to open it up to questions. So if you've got a question, feel free to share that in the chat, or you're welcome to raise your hand, and we're happy to bring you off mute.